Hello friends, my topic for today's discussion is regarding treadmill test or TMT test or cardiac stress test. I'll be discussing this topic in great detail. I have already made a lot of videos where we have discussed this in brief. Today we'll be discussing this topic in detail and what are the advantages, disadvantages, what are the patients where we advise them treadmill, what is the predictive value of this patient in terms of positive predictive value and negative predictive value, and what should we do when the report comes positive or negative, how exactly do we confirm the reports. That all points I'll be discussing during the course of this next few minutes. This topic is going to be extremely interesting, so I would request all of my viewers to see the video till the end. And the people who are new to my channel, I would request them to subscribe to my channel, as this will give us a lot of inspiration and motivation to continue the good work as we are doing now. ये टॉपिक हिंदी भाषा में भी अवेलेबल है मेरे चैनल पर, आप चाहे तो लिंक मैं नीचे डिस्क्रिप्शन बॉक्स में डाल दूंगा, आप उसे देख सकते हैं. कमिंग बैक टू द टॉपिक, माय टॉपिक इज रिगार्डिंग ट्रेडमिल टेस्ट. बेसिकली ट्रेडमिल टेस्ट इज अ स्ट्रेस टेस्ट वेर इन वी आस्क द पेशेंट टू वॉक ऑन अ ट्रेडमिल and the patient is made to exert continuously on a treadmill for a few minutes. The maximum amount of effort which he can put and the maximum number of stages which the patient can cover on a treadmill, that is what we want to see. How much exactly is the effort tolerance of the patient? It is usually done in a patient where the patient comes to us with a complaint of a chest pain and we feel that the patient is maybe cardiac or may not be cardiac. Usually the predictive value of clinical judgment in deciding whether the patient is having a heart problem or not a heart problem is not very high. So it is always better to over investigate and it is always better to evaluate the patient by means of a treadmill test. Sometimes even in relatively young patients also, where the risk factors are not very high, if at all the patient is having a significant amount of exertional dyspnea or significant amount of chest pain, we should do a treadmill test to just confirm whether the patient is having a heart problem or not. Because gone are the days when we used to think that heart attack is a disease which affects only the elderly patients or the patients with a age beyond 50-60. Now even in the early 20s or in the early 30s also, we are seeing a lot of patients coming to us with a heart attack. I have even done an angioplasty in a young boy with the age of 17 years also. So it is not a disease nowadays which affects only the very elderly patients and only the patients with multiple comorbid conditions. It can occur in very young patients also, especially with the young smoking patients. So in very young patients also, even if there are significant risk factors, we should do a treadmill test. I am not saying that if a 10-year-old boy or a 5-year-old boy or 15-year-old guy comes to you with some atypical chest pain, you do a treadmill in these patients. But if at all there are significant risk factors and the patient is having some exertional dyspnea or exertional symptoms, we should ideally get a treadmill test to evaluate this patient. Usually the test does not require the patient to come in an empty stomach. The patient can have a reasonable amount of breakfast or light meal before the treadmill test. In this test, we continuously we get the patient initially prepared. We put electrodes onto the chest and to the arms of the patient, and we get the patient on treadmill. Initially, a demonstration is made to the patient on how exactly he has to walk on a treadmill, and then we ask the patient to walk initially on a slow pace and then on a relatively rapid pace. With every 3 minutes on a standard Bruce protocol, which is the usual protocol which we use for a treadmill, with every 3 minutes the speed of the treadmill also keeps on increasing, and the inclination on which the patient has to be walking on a treadmill, that also keeps on increasing. And with every stage, the amount of exertion which the patient has to make on a treadmill keeps on increasing, and the effort tolerance which is required by the patient is more as the stages of the treadmill increase. Usually the treadmill test takes around 10 to 15 minutes depending on how many minutes the patient has walked on a treadmill. And after the treadmill is finished, we usually ask the patient to have a recovery period or a rest period for 5 to 6 minutes, where we also continuously keep recording the ECGs. Usually while the patient is walking, and for every stages separate ECG printout comes automatically from the device, and this is the change pattern on which the of the patient walking on a treadmill. This change pattern is what we exactly evaluate while we are seeing and deciding whether the patient is having a positive treadmill or a normal treadmill. The person while he is on a treadmill test, the expectation which we have from him is that he should walk for the maximum duration of time which is possible for the patient, and he should try to exert to the maximum upper limit of his ability, because the more time the patient walks on the treadmill, the higher are the chances of the treadmill giving us a definite or a conclusive report. If the patient does not exert and it walks only for 3 to 4 minutes, then there are high chances that the report will be inconclusive. There is a concept which is known as the target heart rate which the patient has to achieve while the patient is walking on a treadmill. This target heart rate is calculated by the formula 220 minus age of the patient. So if at all the patient's age is 40 years, the target heart rate for the patient will be 220 minus 40, that is 180 beats per minute. This is the target heart rate which the patient has to achieve, and if at all the patient has achieved this target heart rate, then and the changes are not there, then we can conclude that the patient is having a positive or a negative report. This target heart rate achievement is much more important to give a negative or a normal report as compared to a positive report, because the patient can have a positive treadmill even in the first stage also, but a negative treadmill is considered to be there only when the patient is able to walk for the maximum possible time on a treadmill and he achieves the target heart rate, or at least 85% of the target heart rate. For example, if the target heart rate of the patient is 200, then we would expect the patient at least to achieve 85% of the target heart rate, that is at least 170 beats per minute should be the effort. The patient should put in that much amount of effort so that his heart rate increases to around 170 beats per minute for a patient with a total target heart rate of 200 beats per minute, that is a 20-year-old patient. Usually a treadmill should be avoided in patients who are having severe chest pain, or in a patient who are very unstable, very fragile, very elderly, patients with very severe obesity, patients with orthopedic problems that they cannot walk on a treadmill, and patients who are not willing to walk on a treadmill, or patients with a recent stroke where they tend to might get imbalanced on walking on a treadmill, or patient with some other orthopedic and neurological problems where the balance of the patient might be compromised. These are the patients where a treadmill should be avoided. The standard Bruce protocol, I will already discuss it. The rate and the speed of machine increases every 3 minutes, and the incline of the machine on which the patient has to walk also increases every 3 minutes. This is the standard protocol and the most validated protocol which is followed all over the world. In the patient where the patient is not being able to walk on a rapid pace, or the patient is elderly or very fragile, we ask the patient for a modified Bruce protocol, which is a slower version of the protocol where the treadmill goes very slow and the rate of increase of the treadmill and the rate of incline of the treadmill is also very slow. Sometimes patients feel that I am a very athletic person, I am exercising on a day-to-day basis, how can I have a positive treadmill? But the amount of exertion which the patient is made on a treadmill is much higher as compared to what the patient routinely does. So the chances of the patient with a normal exercise capacity also, or a person having a very good effort tolerance also, the chances are that the patient might still have a positive treadmill. So even with a very athletic person also, if a patient is having a chest pain, it is still advisable that a treadmill might give us a little bit of new information which might be necessary to get the knowledge about the blockage in these patients. Of course, all of us know that even when a very athletic person and very healthy and hefty person also, the patient might be having blockages. So a treadmill test is a good alternative even in these patients, although the amount of exertion with the patient might be required to achieve a target heart rate will be higher in these patients. The patient is required to stop the rate reducing medicines 2 days before coming for a treadmill. Drugs like beta blockers and calcium channel blockers are asked by the doctor to stop before 2 days he comes for a treadmill test, because these drugs might interfere in the results or the interpretation of the results on a treadmill, and the heart rate will not increase as high as it should normally do. So these drugs we ask the patient to stop for 2 days before he comes for a treadmill. The predictive value of a treadmill is only 70%. That means if at all there is any significant coronary artery blockage, only 70% of the cases that patient will the blockage will be picked up on a treadmill. That means in 30% of the cases we might even have a wrong report, and the patient's test will be coming normal while the patient is having no blockage, and vice versa also, that the patient is having a significant blockage and the test is missing out the blockage. So the predictive value of a treadmill test is only 70%. If at all we have significant risk factors and we feel that the patient is likely to have a wrong report, then we tend to do an angiography to confirm. For all positives and all patients where we tend to have a suspicion that the patient is likely to have a false negative report, we need to get an angiography to confirm the findings. The predictive value of the patient depends on a lot of factors. If at all the patient is having significant chest pain, the risk factors are there, the patient is having some orthopedic problems, the effort tolerance is low. These are the factors which influence the predictive value of a treadmill test. Sometimes patient is having a baseline ECG change on the treadmill, that also might affect the predictive value for treadmill. Some patients, if the patient is having a hypertension or obesity or some other diseases or prior heart attack, these are the diseases where the ECG might be abnormal from the baseline. So the new onset changes which we expect to see when the patient is walking on a treadmill might not be seen in these patients, and the predictive value of the reports might be low in these cases. Some patients with congenital conduction abnormalities like LB morphology and RB morphology on the ECG, these patients are also very less likely to have a good predictive value or on a good or interpretable ECG on a treadmill, if at all we do a treadmill for these patients. If compelled to see the effort tolerance, we still do a treadmill for these patients because this is the easiest test which we do on a routine basis, but usually the predictive value of treadmill will be much lower in these cases. Interpretation of the treadmill we will be talking about now. Usually if the test, the patient is having significant STD changes, or the ST segment is going very low during the exercise, or the patient is having a ST elevation during the treadmill, or if there is some significant arrhythmia during the treadmill, then we consider the report to be positive. If the patient is having no ECG changes and no problems or no STD changes, then the report is considered negative. If the patient is not achieved the target heart rate and the effort tolerance is very low and the changes are, some changes are there but not significant changes are there, or if the patient is having significant baseline ECG changes, then the report might be considered inconclusive. That means we need something else to confirm because this is a doubtful report. If at all the test is patients having severe chest pain also while walking on the treadmill, or significant BP drop while walking on the treadmill, or significant neurological symptoms while walking on a treadmill, these are also considered positive treadmill. Usually the treadmill is categorized depending on what level the patient is having significant ECG changes. We categorize the treadmill on this basis. We might consider the report mild positive, moderate positive, or strongly positive. The people who are having mild positive treadmill, we might allow them to continue with medicines for a few days and then decide whether we need an angio for these patients or not. But in the patients where strong changes are there, deep changes are there, and very early changes are there, very persistent changes are there, these are the patients where we should do an early angiography to confirm whether the patient is having a blockage or not. And ideally the medicine should be started only when we do an angiography to confirm, because cardiac medicines, once they are started, they have to be continued lifelong. And if at all we are not sure in the diagnosis, then it makes no sense that we start the medicine before we confirm the findings. It is just like a patient who is having a cough and we find a patch on a X-ray. We straight away cannot start the patient on a lung cancer treatment. We have to confirm whether the patient is actually having a lung cancer or not, and by a CT scan or a biopsy, and then we can start a treatment. Similarly, if the patient is having a headache, we cannot start straight away a brain tumor treatment. We have to do an MRI, we have to do a scans, we have to do medicines. Then if the MRI confirms that the patient is having a brain tumor and the biopsy also confirms that, then only we can start a treatment. If at all we do not do a confirmatory test and we prematurely start the treatment, it is usually considered not advisable in this scenario. Decide whether the patient is having a positive or a negative treadmill. The concept of target heart rate is important. To give a negative report, the patient has to walk on the treadmill until he achieves the target heart rate. If at all he has not achieved the target heart rate, we have to give the report as inconclusive. To call the report positive, target heart rate achievement may or may not be required, because if the changes are there very early, we usually stop the treadmill as soon as the changes appear on a treadmill. If the patient is having a tachycardia or an arrhythmia while walking on the treadmill, it is usually considered positive, but is not a sure shot sign of a positive treadmill. You still require an angiography in selective cases to decide whether the patient is having a positive treadmill or not. Similarly, the patient can develop a conduction block or a bradycardia or low heart rate while walking on the treadmill. This is usually seen in elderly patient or patients having heart infections, where the conduction system of the heart is compromised and the patient suddenly develops a low heart rate, contrary to what is expected in that patient, because routinely the heart rate should increase while walking on a treadmill. But sometimes the heart rate might suddenly drop while walking on a treadmill. Sometimes the patient might develop a rate-related RBBB, rate-related LBBB, or rate-related CHB on the ECG, and then it becomes difficult to interpret this patient, and sometimes this patient might end up requiring a pacemaker. But all of these patients are really not candidates for pacemaker. Then there is something known as a hypertensive and a hypotensive response on a treadmill. Usually we do not do a treadmill test if the blood pressure of the patient at a baseline is more than 170 millimeters by 100 millimeters diastolic, because usually what is expected that once the patient is getting to walk on a treadmill, the blood pressure of the patient will shoot up. If the patient is already having a very high BP, we do not usually ask the patient to walk on a treadmill. But sometimes the BP might shoot up excessively, that a very normal BP of 120 also might go up to 200, 250. Every stage of the treadmill we keep on checking the blood pressure, but sometimes the patient might have an excessive hypertensive response with a stress. These patients might require treatment of the hypertension with medicines. Sometimes the patient might be having a hypotensive response, that the BP ideally should be going high when we are walking on a treadmill, but sometimes the BP might actually drop on a treadmill. Usually that is also considered a positive treadmill response, and the patient usually requires a angiography to confirm whether he is having a heart blockage or not, or we need to find any significant disease which is causing this hypotensive response. We have already discussed what is the role of angiography after a TMT. Usually the angiography should be done in all cases where the TMT is strongly positive, or where we are having a significant doubt that the patient is having a significant heart problem or a heart blockage. Ideally, without doing an angiography, the patient should not be started on a medicine unless we are having other reasons that the patient is absolutely refusing an angiography. If at all the patient is not being able to walk on a treadmill, we usually ask the patient to do a stress or a chemical stressed dobutamine stress echo or dobutamine stress ECG test, and in this we can use a chemical to stress the heart, and on the basis of the stress we can do serial ECGs and echo to confirm whether the patient is having a blockage or not. Usually if the patient is having a significant heart blockage or significant risk factors are there, sometimes we might straight away do an angiography for these patients where the patient is already at a high risk. But ideally for every patient we cannot keep doing an angiography, because it makes it very cumbersome that every patient who comes with a chest pain, whether he is having risk factors or not, we are straight away doing an angiography. That is usually considered an ineffective way of doing it, and it's not as per the standard protocol. Usually the first test on a patient having a chest pain is usually treadmill test, and if the treadmill comes positive, then we usually take the patient on an angiography. Now we will be discussing what are the other roles of treadmill. Usually in patients who have already undergone angioplasty or heart failure treatment, whether the patient is having a good effort tolerance or not, that is used to assess whether the patient is having a good prognosis or not. If the effort tolerance of the patient is good and it is improving as compared to before, that is a good sign that the patient is responding to the treatment. And we can use it whether the patient is having stent reblockage or not to assess after plasty whether the patient is having a problem with the stent or the bypass grafts, also that can be assessed with the treadmill, or whether the patient is having new onset blockage development in the patient, or if the pre-existing blockage which were less earlier on have now increased, that also can be assessed by use of a treadmill test. So ideally every year one treadmill should be done for all the patients who have already undergone an angioplasty. In patients of complete heart block, or whether the conduction system is diseased, if the patient requires a pacemaker or not, we usually do a treadmill to see whether the patient is achieving a good heart rate while walking or not. If the heart rate is not achieved while walking on a treadmill, then the high chances are there that the patient will require a pacemaker. This is known as a chronotropic competence assessment for the patient. Here we check whether the patient develops an increased heart rate while walking or not. If at all the heart rate response is not normal, then the patient will require a pacemaker. In cardiac rehabilitation also, to see for the improvement in patient's performance and effort tolerance, we do a treadmill. In patients where the patient might be require a valve surgery, also whether the patient is having good effort tolerance or not, we sometimes do a treadmill to see whether the patient requires a surgery or not. If the effort tolerance is good and the problem is small, we usually continue with medicines. But if the problem is big and the effort tolerance is very low, we usually advise the patient early surgery in these cases. In post-plasty and post-bypass patients, I have already discussed that the TMT might be required to confirm whether the condition is good or not. Similarly, we have a test known as stress echo and a stress MRI, stress PET. These are also stress tests wherein we, rather than doing just ECG, we use the patient's, we see the patient's stress response while the patient's heart is being stimulated by a chemical known as dobutamine. Or while walking on a treadmill also, we use a different protocol and we see the pre and the post echo, that is done in a stress echo. And sometimes in stress PET or stress thallium test also, we do it in a similar way that we see the pre and the post exercise response of the patient to exercise, and we see whether the patient is having coronary artery disease or not in response to stress. But conventionally we do a stress ECG only in majority of the cases. Very few cases we are doing a stress PET or a stress thallium or a stress MRI. Either we do a stress ECG or a stress echo in these patients. Stress ECG has a predictive value of 70%, stress echo has a predictive value of 75 to 80%. The purpose of this topic was that I wish to discuss about a treadmill test, what exactly is a treadmill test and what are the pluses and minuses and advantages and disadvantages of a treadmill test. What exactly are the patients where we do a treadmill, and why exactly are the patients where we don't do a treadmill or we do a straightaway angio. What should be done to confirm the findings or refute the findings, and when should the medicines be started after a positive or a negative treadmill test. These are the things which we have discussed. The purpose of my channel is that I wish to make scientifically correct and useful information in a common layman's language available to the common people, so that people can understand the concept of a disease and they can manage and discuss their patients in a better way. Usually patients depend on this information for the cardiologist and on their friends and relatives, but cardiologists and doctors usually may not have sufficient time to deliver all the information to the patients. If at all you like the concept of my channel, I would request you to like and subscribe to my channel, and if at all you feel that the videos are useful for your friends and relatives, you can share the link of the videos to your friends. And if you have some comments, queries and suggestions, or if you want some new topics for us to be discussed in the future upcoming videos, you can mention about them in the comment section, and we'll be happy to incorporate these suggestions and make new videos on the new topics which have been advised by you. So in the end, this is Dr. Navin Agrawal. I thank you all for the very patient listening for my topic, and I hope that I was successful in making the topic clear. If at all you still have any questions and queries, feel free to ask us about them. And the people who are new to my channel, I would request them to subscribe to my channel, as this would give us a lot of inspiration and motivation to continue the good work as we are doing now.